The Health Department says it's instituted public health response measures to prevent the spread of monkeypox. A fourth case has been announced by government. The patient has apparently a travel history to Spain and returned to South Africa just earlier this month. Health Minister Dr Joe Phaahla is set to brief the country on Friday on government's response to the virus. But in the meantime, let's speak to Deputy Health Minister Dr Sibongiseni Dhlomo, who joins us via our video link this morning. Dr Dhlomo, great to see you. Thanks very much indeed for coming on. How worried should we be by this fourth case?
We need to be less worried. We are informing the society because we have termed monkeypox as one of the notifiable disease, so that you get it in one area and therefore you trace the contacts. You don't hear about it when 1,000 or more people have been infected. It is not really a big problem in our country and in our continent. As you might recall, you can't even remember when we had a third case. The third case was on the 10th of July. Also a tourist who was picked up in Limpopo coming in from Switzerland. The second case before that was on the 28th of June, Western Cape Mail, and the first case was on the 22nd of June in Gauteng. So these cases are few and far in between, and we are actually bringing it up to saying it's much better than if you were to contact any other infectious disease. But however, we need to pick up some lessons that we got from COVID, that if you actually have a personal hygiene, shake hands after washing, and actually avoid close contacts on infectious disease, you are likely to be in the same studio with you, ma'am, and not get a monkeypox if I actually am careful. So we are actually reporting it because it's a notifiable disease. However, it's not one of those that is really worrying us. But as we are rightly putting it, the Minister on Friday will expand much more on our plans to really how to take it forward protocol-wise in terms of this monkeypox, which is not really a pandemic for us, but one of those notifiable diseases that we are picking up here.
So you're just keeping the public up to speed. So shall we take a step back, Dr. Dhlomo, and give us a sense of what monkeypox is and who are the people who are at risk?
Yeah, monkeypox is like one of those viral infections. What me and you probably would remember from our grandmothers, there was what we call smallpox. It was eradicated through vaccination, and then what we see now is a bit of a twin chicken pox, which is also in children when they get when they're getting born, they go through a program of vaccination against chicken pox. It's a flu-like illness which probably associated with headaches. It has got some skin lesions once it is manifesting itself, including hands and the body, upper trunk mainly, and it's itchy, and it's usually self-limiting. It's not really life-threatening. We haven't really, all that we do is to treat like a symptom, an illness like it's flu, and you treat symptomatically. If it's itchy, you put on a bit of some of these lotions that will stop it to be itchy and maybe headaches. And then if it's getting to be a real flu, like you treat it like you would treat flu. But we do not have a specific to say this is a tablet for monkeypox, because that we have not gone that far. And I was actually asked yesterday, we are not really seeing our researchers putting a lot of effort in really researching on monkeypox, because it's not really a big problem for this part of the world. Yes, maybe in other parts of the world they are really putting a lot of effort in really trying to curb it and do a lot of research on it.
So you're saying here in South Africa we're not using a vaccine insofar as monkeypox is concerned?
There's no vaccine yet. I would still encourage you, ma'am, that we encourage South Africans to continue with the vaccines that we have. One of them is against COVID, because we may not actually ever tell there's not going to be another COVID wave. And the better we are vaccinated if we do get any other a wave in the future. But for monkeypox, we don't have any vaccines yet. And it is actually not one of our areas of real firm priority as it is, because it is really not worrying our society for now.
Dr. Dhlomo, for someone who might be concerned whether they've traveled abroad, whether they feel that they may have come into contact with someone else who has monkeypox, what would be the next steps there insofar as isolation and seeking out medical treatment is concerned?
Yeah, we are not doing that massive testing that we used to do when we were having COVID-19. But however, if you have a history of travel and you probably come back mainly from the Europe and the US where there is a big sort of outbreak of this monkeypox, and maybe Central Africa, do come back home if you have any suspicious flu-like lesions, and they do test any private or public lab, and then they will also do that and confirm if you do, and therefore immediately you will also get your close contact tested. But again, as I'm saying, it is just to confirm and get to know you do or don't have it. It is really not a life-threatening illness, even if you do pick it up.
All right, Dr. Dhlomo, let me thank you for your time this morning, the Deputy Health Minister. And just a note that the Health Minister, Dr. Joe Phaahla, is set to give a broader update to the country on Friday insofar as government's response to the virus is concerned.